record button. Today's session is sponsored by the Healthcare Authority in Washington State. And we have some amazing presenters to finish out our last session for the Learning Community on Cultural Responsiveness. Today's session is about working with tribal communities. And our presenters for today are coming in from Washington State. We have Christine Nguyen from the Office of Tribal Affairs, and we have Lucille Mendoza coming in from the Tribal Behavioral Health Administrator Office. And I'm going to open it up and let them introduce today's topic and give them introduce themselves in terms of further information about where they're coming from and their expertise on this area.
Good morning, everybody. Is my screen sharing?
I can see the slides, yes.
Great. I'm Chrissy Nguyen, and as you've heard, I'm from the Office of Tribal Affairs here at the Healthcare Authority. I'm also an enrolled member of the Quinault Indian Nation, which is here on the west coast of Washington. I grew up here in Washington. I currently live on my reservation, have close familial ties, and happy to be here today to talk a little bit about Indian country and why we do the things that we do and why we should do the things we should do and how we can improve. Lucy, can you introduce yourself, please?
Yeah, thank you so much for joining today. My name is Lucila Mendoza. I also go by Lucy, and I also work with our Healthcare Authority's Office of Tribal Affairs. And Chrissy's actually my supervisor and a wonderful one at that. But it sounds like it's good evening where you all are at. We're still in the afternoon, nice and sunny. But yeah, a little bit about me. I've worked with our office in this position as a tribal behavior health administrator for about 7 years, 10 years with the state. I'm not a tribal member. I'm Mexican American, and just really have a lot of gratitude for the work that I am able to do. I get the opportunity to do. It's an honor to work in partnership with tribes. I started working with tribes early on in my career on our statewide prevention team, and, really appreciated and, fell in love with the government to government work and the work that we were doing in partnership with tribes, serving Native communities across the state. And so it's just been a blessing to continue that work in my new role. I focus on behavior health and crisis topics. So thank you all.
Okay, so with that, we are going to run through this whole slide deck. We're going to try to get through it within about an hour time frame so that you guys have an opportunity to ask questions if you have any. We'll probably be a little bit over an hour. We're hoping to at least give you 20 minutes to ask questions. So with that, we'll start. Tribal sovereignty and then in healthcare delivery. So tribal sovereignty, government to government relations, what is it and why? Right there we have a little excerpt of the treaty with Suquamish, which is a tribe across from Seattle here in Washington, across the water. Historical precedents for American Indian Alaska Native policy, goes back to 1492, Doctrine of Discovery. There was a treaty making era. Then there was the Indian removal. We're going to get the Indians out of the way so we can build our cities and make this a great country, right? Then we have the reservation era where we're putting all of our folks, tribal people, within reservations in exchange for the rights to the lands that they ceded. Then there's allotment and assimilation. We'll talk a little bit about that later on in this presentation, how that was abused and how it led to very destructive events within Indian country that they're still trying to recover from. And then there's the Indian Reorganization Act 1930s to 1945s. There was the disgraceful termination and removal where they terminated hundreds of tribes within the United States and basically said, you guys aren't Indian anymore. And then there's the new dawn, better relationship era, self-determination without termination, 1970s to present. We're making things better. Do we have it right? Nah, probably not, but we're improving. Federal Indian policy. It's called the trifecta, the Marshall Trilogy, U.S. Supreme Court rulings. Johnson v. McIntosh establishes only the federal government could extinguish tribal title to land, limiting individuals from purchasing land from tribes. So during this era, what we had was a lot of land claims people coming in, basically selling Indian land to non-tribal people. And it was causing problems, basically taking away the land that was given to the people. And the this first decision that was written by John Marshall said, yeah, you can't do that. And pretty much that's where the start of the BIA came from, Bureau of Indian Affairs, where they governed what happened within the reservation boundaries. Cherokee Nation versus Georgia, that determined that tribes are sovereign. They're not as sovereign as a foreign country like Mexico or Canada around us, but they are more sovereign than a state would be under federal law. Worcester v. Georgia, that established that state law does not extend into Indian territory. Only federal law extends into there. And that's why there's a very unique relationship between the tribes and states. Martin v. Mancari, is an important, I think it's really important now and very relevant. It established that the treatment and the way you deal with tribal nations is due to a political relationship that exists between the United States government and Indian nations. And it's not a racial relationship. I often hear people misspeak about the way the tribes are dealt with. They'll say things like, "Well, I don't think we address issues in other minority communities like we do with tribes," and right there, that tells me that they are under the impression that it's a racial issue. And it's not. It's a political issue. That the tribes have certain rights that have been given to them through treaties that makes that relationship between the federal government and them political, not racial. And so when states deal with them, you can't look at Indian tribes as a racial group. You have to look at them as a governing body, a government to government relation. So in Washington state, we have a number of treaties that apply. Some treaties apply to several tribes, others just apply to one. They're all unique. There are similarities between them, but every tribe negotiated their treaties for their own distinct and unique needs. The things that are similar is, guaranteed housing, guaranteed education, guaranteed health care. And that's pretty much what we're going to talk a lot about today. But you have to make note that every tribe is different. So in Washington state, you have the Yakama Nation. They have the right to interstate commerce. They specifically preserved that right in their treaty. And so that means that they can haul things down the highway across state lines. It's in their treaty. They're the one tribe in the state of Washington that has that ability because they directly negotiated that unique right. Macaw Treaty guarantees the ability to whale and hunt seals, specifically in their treaty. They're the only tribe that actually preserved that in writing in their treaty. The other whaling tribes and sealing tribes within Washington state didn't think to specifically outline that in their treaty, and so they have a lot more difficult time exercising those treaty rights. Sovereignty, a definition. So this was spoke by Joseph Dela Cruz, who was the chairman of my tribe. When I was a kid, I grew up calling him uncle. No right is more sacred to a nation, to a people, than the right to self-determine its social, economic, political, and cultural future without external interference. The fullest expression of this right occurs when a nation governs itself. We call this exercise of this right self-determination. The practice of this right is self-government. Uh, you really have to take a close look at what he's saying here. And basically it's saying, the native people have the right to determine how they want to live, what laws they want to apply within their boundaries, and not be interfered with. And you'll find that culturally, tribes are very different than Western culture, and so their laws reflect that. Uh, and on our reservation, we have rights that are written about grandparents' rights to see grandchildren. That's not very common outside of reservation boundaries. We have laws about you can't date your cousins, or you can't marry your cousin, right? Well, you're just not allowed to do that within the reservation boundaries. So very unique. And there's always reasons behind it, why we do the things we do, and they're rooted in our culture and who we are as a people. So federal law, trust responsibilities. Congress declared that the special trust responsibilities and legal obligations that the U.S. government has to indigenous people within the United States is to give them the highest possible health status, raise their health status to meet goals that they've set, ensure maximum Indian participation in the direction of healthcare services, increase the proportion of all degrees with healthcare professionals that are indigenous, consult with tribes, meaningful consultation with tribes and urban organizations when you're creating healthcare policy, ensure that there are government to government relationships, and that we respect those relationships, and fund the programs. And we'll talk a little bit about that later. So the federal trust responsibility was created through 375 ratified treaties and several pieces of legislation. All are based on self-determination and sovereignty. Like we said, some of the commonalities within these treaties are a guarantee of food, housing, education, healthcare, economic workforce development. The Indian Healthcare Improvement Act created the Urban Indian Health Program. Why is the Urban Indian Health Program important? Well, 70% of tribal populations in Washington state, and I'm sure that's a similar number in other states, live in urban areas. And so you have to have an Indian health program that can service those individuals in those urban areas, not necessarily reservation based. Extended self-determination to 638 tribes. So 638 tribes healthcare programs are programs that are ran by the tribe rather than the Indian Health Service. So they're ran by the local tribal government. IHS facilities are ran by the federal government. There's a difference. States must accept the licenses of providers throughout the country, regardless of what state they're licensed, when they work at the Indian healthcare facilities. And that's in recognition that state law just doesn't apply in Indian country. And one of the key elements in there is that American Indian Alaska Native patients don't have to go into MCOs, and they can choose their Indian healthcare provider team as their primary provider if they are in an MCO. Because, networks, right? We want to make sure that if a tribal member does opt to be in a managed care program, they can still have their tribal provider, their provider that's close to them within their reservation, provide them services. And in Washington, we have a very unique thing called the Washington Centennial Accord, established in 1989, and it's been renewed every year since. And the state of Washington just basically sat down with the tribes and said, hey, we want to create a framework of how we're going to engage with tribes, and we want your input. We want to build this together. And that's exactly what they did. they collaborated with the tribes and they developed this framework, which calls for meaningful consultation and protocols for when there's disagreements. And it's very unique and it's a wonderful thing for the tribes in the state of Washington. I can say that because I'm a tribal member and I've witnessed how it works, and it's a great thing. Is it perfect? No, but Washington State has a lot to be proud of when it comes to this Washington Centennial Accord. You can Google it and read about it. Not it's not complicated. It's actually very simple, and it really gives the tribal people within this state a voice in healthcare policy that impacts their communities. So part two, 200 years of broken trust, why trust is important for government to government cross-cultural relationships. So I talked a little bit about the allotment era. If you look at this map, this red map, you see these little squares. And what they did, and they did it on my reservation as well, is they divided up the reservation that was promised to us for, ever. And they said, okay, 80-acre parcels, you get an 80-acre parcel, you get an 88-acre parcel, you get an 88-acre, right? And they just gave 80-acre parcels within the reservation to every Indian they could find, and oftentimes non-Indians who they could find. And so that resulted in 1960s, the Quinault Nation owned about 2% of their reservation, and the rest was either owned by tribal members or non-tribal people. Since that time, the Quinault Nation has implemented a plan to buy back the reservation, and I'm proud to say we own the nation owns about 55% of the reservation now, and about an additional 35% is owned by tribal members, and only about 10% is owned by non-tribal members, which is amazing. You can see in 1892, the Colville Indian Reservation lost half of its land because mineral rights were discovered there. They sued in later years and received some compensation and got some of the land back. And you can see that between 1954 and 66, the Congress unilaterally terminated or relocated 109 tribes. Destruction of tribal societies. If you've watched the news, I think you've probably heard about the Indian boarding schools, particularly in Canada, where they're talking about babies and kids buried in the school grounds. That occurred in the United States as well. Tribal members, tribal people, children, I shouldn't call them people, tribal children went to these schools and they were abused horrifically. Every Native community has horrific stories of what occurred to their people at these schools. And, it created an era of ACE scores that are off the charts. And those have lasting and long impacts. And if the boarding schools weren't bad enough, then, we got into the era of let's take the Indian babies out of the homes and put them in non-tribal homes to get them to assimilate. Kill the Indian, save the man kind of mentality. And so we have a whole generation, we call them scoop babies, that were taken between 1940 and the 1970s, who didn't grow up on their reservations. And, many of them found their way back to us, and they have a lot of trauma from what occurred to them. But it's why we have a hard time trusting anybody when they come and say they're here to help us. Missing and murdered Indigenous women and people. American women, American Indian and Alaska Native women, about 84.3% of us are victims of physical violence. 56.1% are victims of sexual violence. American Indian and Alaska Native men and women, second highest rate of homicide in 2020. Homicide is in the top 10 causes of death for Native men 1 through 54 and women ages 1 to 45. I have my own father has been missing since 1998, and we've never found him. We've never been able to bury him. And my story is far too common within an Indian country. Our people disappear with no trace. So historical generational trauma, ACEs, high ACE scores. I have an ACE score of 9.5. And, I'm really proud of the fact that my children have an ACE score of 1. And, breaking those generational traumas, it takes years, it takes generations. And so when you have these kinds of high ACE scores, when you have this history of abuse and trauma in your community, you're going to have high levels of high prevalence of sickness within your community, chronic illnesses, and horrific outcomes, health outcomes. So results of those disparities and premature mortality rates, the red line is Native Americans. You can see that they're top of the list in all but 2 on coronary heart disease and diabetes. You can see that Pacific Islanders are a little bit higher, but they're also Indigenous people and have suffered pretty similar fates as us. And today, even moving forward, it's really interesting to look at unexplained increased mortality rates in our population that still exists today. COVID-19, we lost tribal people lost 6 years of our average lifespan due to COVID. In my own community, we have a community of 800 people. We lost over 15 people to COVID-19. That's a startling statistic if you think about how COVID played out in other communities. You can see that Black and white patients went into the hospital. Their mortality rates were 75% lower than American Indians and Alaskan Natives, despite the fact that we, the natives, had lower morbidity risk scores. Childbirth in 2024, pregnancy-related mortality rates for us is much higher. 63.4 pregnancy-related mortalities compared to 55.9 for Black women, 22.6 for Hispanic, 18.1 for white, and 14.2 for Asians. There are some serious health disparities that really can only be addressed by addressing the trauma that exists within our communities and the systemic barriers we have to providing culturally attuned care for this group of people. So severe underfunding of IHS. We got this nifty graph that you can look at. It only went up to 2016. We couldn't find a new one. So we went and we Googled to find out what we're spending and talk about how underfunded the tribal systems are. So IHS beneficiaries, they're funded for about $4,078 a year. And if you look at Medicare average per person is $9,427. Medicaid, anywhere between $8,800 and $9,300. Veterans, we pay $14,400 on average per veteran. The U.S. average is $13,000. Federal prisoners, I couldn't find an up-to-date answer. The last one I had, I couldn't find the 2022, but I found the 2019, and the last number they had was about 8,800 as well. And so best case scenario, the average individual is getting 2.2 times more money put into their healthcare system than tribal people are, seriously underfunded. We have the most complex healthcare delivery system, I think, in the world. I think the United States is known for having the most complicated, and we are the most complicated within the US. And the reason why it's so complicated is there's lots of different ways to receive your healthcare within an Indian country. You have federal facilities. We talked a little bit about that. IHS facilities. Those are ran by the federal government. They can exist within a reservation. The tribe doesn't operate those clinics. They ship people in to run them that are federal employees. And then you have tribal health facilities. These are 638 facilities. The vast majority of facilities within Washington state are 638 facilities, which are ran by the tribes. They directly contract with the IHS service to provide these services to their own individuals, that provides an opportunity for tribes to make their own decisions and decide what their care is going to look like within their own communities. And of course, we have the urbans, which provide care for the indigenous populations in those urban areas. And like we've discussed, 70% of our populations are in those urban areas. So urban organizations are a huge need within the indigenous communities to make sure that those needs are met. Many individuals, many tribal people don't live anywhere near the reservation. They'll live here in Washington State, but their people are from North Dakota. So this meets that need, that they're getting culturally appropriate care. Culturally appropriate care has much better health outcomes. And, this is just a list of positive legal history in relations to tribes. I think you guys are all going to get a copy of this PowerPoint. We just wanted to give you a list. You can look it up if you're really interested. This has some great cases in it that just informs you on why things are the way they are. Best practices for tribal engagement and collaboration. So cultural attunement, communication with Native individuals. It's really important. I always say this when I talk to people trying to learn how to communicate with tribes, is that the cadence of our discussions within a tribal community is very different than the cadence in the Western world. I'm speaking to you now in a Western world cadence. It's very quick, to the point, not a lot of pauses. And what you will find when you are in a tribal community is that the cadence is much slower. There will be long pauses between statements. And it's the habit of people who come into our communities to speak with that Western cadence, and they don't even know that they're interrupting somebody when they're speaking. And so I always say, in Indian country, you really need to wait until it feels uncomfortable to you. The silence feels uncomfortable to you before you speak. And when you're asking for input, I always tell folks that you need to ask 3 times. So does anybody have any comments on this? And you wait, and if you don't get anything that first time, then you say, this is really a good opportunity for anybody. If you have anything to say, if you have any input on this, we would really like your input. And then you wait. And, the third time you say, okay, we want to make sure that if there's any input that we've given an opportunity. And then you wait. And if you don't get a comment by the third time, then yeah, okay, it's okay to move on. But far too often we move on too quickly. People don't get in what they want to say, and we interrupt tribal people when they're speaking. And so when a tribal person is talking, you literally have to wait much longer than you would in a normal Western conversation, because that's how we speak. And the older the generation, the more that pause is going to be into effect. For me, I ramble, I talk fast, but my father, no. My grandmother, absolutely not. You had to sit there and be very patient and very quiet. So it just depends on the audience, but you should always wait. Native communities really have a lot of different rules and values. And so what you will often find is we have a schedule, we have an agenda in the Western world, and we're trying to stick to the time. We got 15 minutes for this subject, and we got 10 for this, and we need to get through this. And that's not how Indian country works. In Indian country, if an elder wants to get up and talk for 30 minutes on a something that we've had on our agenda that should only take 10 minutes, the elder is allowed to take 30 minutes. And you just have to understand that when you are in Indian country, that your agenda is nice. It might help keep you on track, but don't think you're going to follow that timeline. You may end up being there a lot longer than you expected and having a conversation that goes into the weeds. And that's just how they are. That's how we are. We respect people's right to have a conversation and give their opinions and speak their minds. And particularly when they're elders, you're going to see a lot more leeway when it comes to what they have to say. So culturally appropriate care, key points, relationships and ways of interacting with our spirit, relationships and ways of interacting with our people, relationships and ways of interacting with nature and the physical world. You will find that the tribes who are, you'll find study after study that the tribes who have strong, active cultural programming within their community. And I'm calling it programming, but it's really just our culture, right? We don't consider it programming. But they have these activities for their children, for their membership to be involved in their culture, whether it's singing, drumming, dancing, artistic. Those tribes have better health outcomes. They have better educational attainment. They have better or better results for chronic disease. Literally their culture is what heals them. And so it's really important that if you're going to be in a native setting and you're trying to create programs, that you get the community involved and you create belonging and identity. And you can't do that. You have to rely on the people in the community to help you build it. Trauma-informed care. This slide, I just changed it. This had a whole bunch of things about what you need to do with trauma-informed care, and it just didn't do it justice. And so I changed it, and it says, if the best time to have taken this trauma-informed care training is yesterday, the next best is today. Tomorrow, well, okay, but next week, next month, not optimal. Trauma-informed care, trauma-informed staff is the single most effective way to meet the unique needs of the most traumatized people in the Americas. I can't say enough about trauma-informed care and how effective it is in creating dramatic change within our healthcare system. If you don't have a program that requires everybody to get trauma-informed care, you need it. Lucy, do you want to take over on this slide? Oh, you're on mute.
I am on mute. So yeah, I think we just wanted, to share a little bit, especially in our state. We get this question quite a bit, like, what are best ways to ensure we're appropriately like referring individuals to or native individuals to behavioral health facilities that may be outside. And I, definitely appreciate Chrissy's presentation so far. And really, I think one of the highlights, or not highlights, but one of the kind of regular activities of our team is just to make sure our system partners that they're we can support them in referring individuals to their tribal communities, their healthcare providers within the tribal setting. They provide the most appropriate care. So I think that's one of the definite messages we share is, if there are tribal programs or tribal services, be sure to be aware of those, be sure to offer those. But there's also, individuals that, may want to, attend or go to a service provider that is, non-tribal, and that's really their choice, as long as they're offered those, tribal services or coordination with their Indian healthcare provider. But it's also important because going back to the slide on the healthcare delivery system, there's a lot of misconceptions, misinformation about uh, insurance coverage and uh, you know who's going to pay for the service. And so that really comes into play. And what we've seen in Washington state, not sure if this, I'm sure this happens in other states. Um, there's a misconception that the tribe's going to pay for the care, or there's like a tribal insurance. I just actually saw that on my own insurance as an option, and I'm like, that's not a thing. I want to call them. So I think it's just making sure that you're consulting with with the subject matter experts who know, which again, that goes back to the tribal health programs or tribal benefits coordinators, as being the folks that really understand the healthcare delivery system for Native people, and can help, you know, act, support access to resources. And again, there are, like in Washington state, we have at least three um, tribally operated um, inpatient residential treatment facilities that provide cultural services. We have um, at least 10 and more on the way opioid treatment programs. Many of those programs have mobile medication units where they could provide medications for opioid use disorders in different parts of their region. And so there, I know in Washington state there's so many resources, tribal resources, urban Indian health programs. And so I think those are really important factors, but also just connecting with the individual as you're referring. Do you want to access, cultural services within your treatment? Um, uh, those are some important things. So I think I'll leave it at that. And can you go to the next slide, Chrissy? I'm not sure if it's still me or, yeah, I think we've, covered most of this. So next slide, please. I think this is pretty similar, just in in coordinating care, communication with an individual's Indian healthcare provider, their tribal service provider, if they're accessing services within an urban Indian health clinic. I think what we see and what's been a concern from tribes sharing with us and trying to figure out some strategies in partnership is when an individual gets referred out for like a specialty care, something that can't is not provided at the tribe, that individual might get kind of taken away from that system, put into a system that isn't really working for them. Um, there's a lack of care coordination with the tribe, so they might, for example, get their insurance switched over and lose their primary care provider. I mean, there's all kinds of things that have happened, and that are harmful. And so it's really important to communicate and coordinate with um, healthcare clinics that the tribes operate, that the individual is, accessing care at. And it's just so important. There's a lot of times where there's individuals that need additional supports, or there's a gap for, they might be not located, or they're not living near their tribal reservation. And so we see that as individuals in that situation having quite a few gaps. And so, there's times where we bring so many people together. We're bringing in, if they're in managed care. If they're not, then we bring in our staff, our teams that help support with care coordination. Is there a crisis team involved? And so, sometimes there's a multidisciplinary team. So I just can't stress the importance of care coordination, really working and consulting with and connecting with Indian healthcare providers, just to be sure individuals get access to care that they need. So, Chrissy, feel free to jump in anytime, but we can go to the next slide. Are we gonna have time to play that video or?
I think we do have time. So this is just a quick little video. Uh, what we really liked about it is, our team here at the Healthcare Authority is we have a lot of tribal members that work within the Office of Tribal Affairs, and so we're really fortunate in that. And so one of our staff found this, and it's just a really um, it's a really great video on resiliency and how this generation of tribal people are working really hard to break those generational curses. Hopefully you can hear it.
I cannot hear the sound.
Mhm.
Typically, if you go back to share screen, if you click that green button again, you'll have at the bottom right corner a little toggle box that says share sound.
Okay. There's sound. Okay.
One morning
Perfect.
I woke up and I heard my brother crying. He was screaming so loud you thought someone was dying. Mom, Dad, he screamed, but there was no use trying. They weren't around. I ran outside and saw he'd had a pretty bad crash. His bike was in the ditch, down his arm a bloody gash. He looked so pitiful just sitting there in the dirt amongst the trash crying, I want Mom and Dad. I picked him up and started running toward my uncle's up the way. It started raining and got real dark, he could barely tell it was day. My brother cried and asked, Sister, where's Mom? I didn't know what to say, when the truth is, I don't know. When my uncle saw us coming, he ran into the yard. He took my brother from me and he held him in his arms. When he saw my face, I could tell he was alarmed. And he said, what happened? Did you fall too? Uncle, I'm so tired of wondering why. Why do they drink? Why do they do drugs? Why do they leave us? Why? He said, Sister, it's hard to explain. And I said, Uncle, try. And then he told this story.
Once this land was teepees as far as you can see. The water was clean, the land pristine. We were where we were meant to be. Then strangers came across the sea and brought with them their disease. Our people cried and prayed and sang, but it brought them to their knees.
We will rise up from the darkness. We will overcome the pain. Warrior spirits live within us. We shall remain.
Imagine that your family, and most of all your tribe, what if most of everyone you love suddenly got sick and died? And before you even had a chance to bury them and mourn, the strangers came and took away the land where you were born. And you wondered if your parents even cared as they stole you and your brother away, or if they'd been so beaten down they had nothing left to say. And then at school, they cut your hair and beat you if you spoke. The language that Creator gave our people when earth awoke.
We will rise up from the darkness. We will overcome the pain. Warrior spirits live within us. We shall
Sister, I'm not trying to tell you that your mom and dad are okay, or that they're not responsible for the choices that they've made. But you see this bloody wound on your little brother's arm. If we don't clean it, it won't heal, and it'll do all kinds of harm. Those deep wounds of our ancestors still bleed within our hearts. When we remember all they've done, that's where the healing starts. So every morning when you wake, you pray this prayer out loud. Creator, help me live in a way that would make my ancestors proud.
We will rise up from the darkness.
Don't you forget this. You can be anything you want to be.
We will overcome the pain.
Just work hard, never give up. Perseverance is the key.
For your spirits live within
Strength,
us.
dignity, honor, that's all in your family tree. So hold your head up high and know that.
We shall remain. We will rise up from the darkness.
Creator, help me live in a way that will make my ancestors proud.
We will overcome the pain.
Creator, help me live in a way that will make my ancestors proud.
For your spirits live within us.
Creator, help me live in a way that will make my ancestors proud.
We shall remain.
Little brother, we will rise up from this darkness. Little brother, we will overcome the pain. Remember, warrior spirits live within us. We shall remain.
Every time I see this video,
What if
I stop and I think about different things. And this time, looking at this video, you know, they've taken an old picture and they've just kind of blacked out people talking about how, you know, a lot of the people and, you know, we died from illness. And this picture doesn't do it justice. You know, the statistics on how many of us died from epidemics was about 90% of us. So one out of 10 survived. And you know, my great grandmother, she came to the Quinault Nation on a canoe prior to the turn, about 1886 and or 1896. She came and she came from Canada, and the reason she came was because she was sent to boarding school, and a Chilean priest impregnated her. And she was one of the lucky ones. She got sent home because she was pregnant. And when she came home, her mother and her father were deceased. All of her siblings had been farmed out to different family members, and she was alone. And so the family that survived decided that she was going to get sent to her uncle, who had married into the Quinault tribe, married a Quinault woman. And so at the age of 14, pregnant, she took a canoe from Vancouver Island and came down through what's now called the Coast Salish Sea, the Coast Salish Straits, and down the coast of Washington to Quinault. And in my grandmother's lifetime, she witnessed from going from canoes to covered wagons, horses, to, you know, old cars, to modern day cars. She passed away when I was about 14 in the 90s. So she was well over 100 years old. So, you know, think of the devastation and the loss of cultural knowledge and your way of life when you have 90% of your community that passes away. Let's see. Next slide. So best practices to rebuild trust. You know, trust is an issue with us. You know, there's a lot of conversations within Native communities about the broken treaties. A lot of conversations about, you know, the way the way our lines were moved within our treaties. Some tribes have gotten some sort of justice. You know, the Quinault Nation sued for a part of their land that was taken from us. We call it the North Boundary Settlement. You know, the National Park Service came in and they created a national park within our reservation boundaries around our lake, Lake Quinault. It's ours. And per the treaty, it's ours. And so we sued them, I want to say in the 80s or 90s, and we won. We didn't get our land back. We got a different section of land that's kind of adjacent to our reservation, and we were compensated some money. Would we have liked our land back? Yeah, but by then there's people own houses, you know, within that boundary. And you know, Colville also sued for the half of their reservation that they lost. They got some money back, they got some land back, and there's lots of examples of that within Indian country. And so, you know, to understand the connection that we feel towards that small set of land that was reserved for us, you know, our natural area where we have hunted and fished is far larger. You know, we've been on these lands for millennia, and you know, so we preserve these little small sections of, you know, huge areas of land that used to belong to us. And so to say that we're very protective of that land, and that you know, it means a lot to us, and that, you know, if you come to our land, you need permission to come to our land. When you come to our land, you should come with a sense of humility, and not with a sense of I'm going to help you and I'm going to tell you how I'm going to help you. You know, there's in Indian communities, there's a lot of conversations about anthropologists who have come, and they just kind of write their own story that, you know, we'll read it and we'll crack up laughing, you know. And there's lots of instances where historical anthropologists came through the town, and they would pay for stories. And so some of the tribal people, they would just make up the wildest stories, and they ended up in these books that are, you know, considered educational. And, you know, Native people read these today, and we just crack up because we know who told that story, and we've talked to that person. That person was like, yeah, I made up so many stories for that guy, right? And you know, they told their grandkids, and their grandkids have talked about it to this day. So understanding that what you've read about tribal people probably isn't accurate, and that, you know, when you come here, you should just be open. When you come to our lands and deal with us, you should be very open to broadening your horizons and understandings, and be humble enough to understand that you really don't know anything about us unless you've lived in our communities for quite some time. So get to know tribal staff. You know, people have a really hard time getting information from tribes. I never have a problem getting information from tribes, but that's because I understand tribes. You know, I've worked for tribal governments for 30 years. You know, I'm new to state government, and I grew up on my reservation. I love my reservation. I still live on my reservation. And you know, the reason I don't have a problem with getting a hold of people within the tribe is because I understand who has the power, and it's not any different than anywhere else. Who knows everything? The secretaries, the administrative assistants, they know everything. You know, the managers, the council, they don't know any of it. They rely on their secretaries. So I always call for the tribal council administrator, and I'll just say, hey, I need help. You know, I don't know who to contact. And you know what? Never fails. And I can always get what I need from the tribes. And so understanding that, and understanding how to reach somebody who has that depth of knowledge for a tribal nation is very important. Take the time to listen to their stories, learn the unspoken rules within our community. You know, in Washington, you know, you don't point, don't ever point at a tribal person. It's very insulting. But you know, I in Alaska, you know, you can point, but you can point to things. You know, you can't point to a person. But in Washington, you don't even point to things. You know, every place is different. You need to learn their etiquette. Make sure that you plan for your meetings. Make sure that if you commit to something, that you stick with it, that you do not go back on your word. Because if you say it, don't overpromise. If you say it and you don't deliver it, it will take you years, if ever, to reestablish your trust with that community. And we've already talked about elders, and community helpers. You know, you just you just have to understand and know that things are a little bit different, and you just need to be patient when it comes to the allowances you will see when you're in meetings with tribal people. Land acknowledgements. We get this question all the time. Should you do land acknowledgements? Should you not? You know, I do not like land acknowledgements. I work for the state of Washington now, which is unique for Indian, to be in that position where they're kind of asking you to do land acknowledgements, and I just won't do them. Should you do a land acknowledgement if you're a non-tribal person? You're coming, it's a mixed result. Half of Indian country doesn't like land acknowledgements, and half the country does. So, I'll leave that up to you, whether you want to. Yeah, I can't give you a yay or nay on that. I don't like them. I think that most of the time that they are not based on anything other than just to say, hey, I acknowledge the land. My supervisor, Aaron Spark, he does a land acknowledgement, and it's actually the best one I've heard. And what he acknowledges in his land acknowledgement is what us as an agency, the healthcare authority, what we are doing to improve relationships between the tribes, and what work we're trying to push forward to assist the tribes. You have to be very careful with your wording, and be very humble when you do a land acknowledgement. It's always good to acknowledge the land. And, in an Indian community, what we always do, and I guess it's a form of land acknowledgement, is we acknowledge the land that we're on. So when I go to Chehalis, I thank the Chehalis tribe for allowing me to be there, right? That is probably the safest land acknowledgement you can give. Like, if you go to a tribal entity, you acknowledge where you are, even if it's a multi-tribal meeting where there's 100 tribes there. If that's tribal land, a specific tribe, you acknowledge that. Say, I really want to thank this tribe for allowing us to be here today and do this important work. So, tribal liaisons, you need them. You have to have them. The whether they're tribal or non-tribal, you need them. You need to be able to establish those kind of relationships. You want to be able to pick up a phone and have one person who knows how to contact the tribes. It's very important. In Washington State, they prioritize that. Recently, the tribal offices within the state agencies have been moving towards having the tribal office report directly to the director, be on the executive committee. And that's just in recognition of how involved the tribes are in the political arena within the state of Washington, and how many tribes we have. We have 29 tribes. So, and, coordinating activities between different entities. The Department of Health is totally integrated in our work at the Healthcare Authority, licensing, being able to have those good, strong relationships with the DOH so that we can assist tribes in whatever they need. It's vital. In Washington State, we have the American Indian Health Commission, which represents all 29 tribes at the state level for the needs that they have, and gives them a voice in our healthcare policy setting process. Northwest Portland Area Indian Health Board, they interact with tribes in our region, Idaho, Oregon, I think Montana and Alaska. An Office of Indian Policy, and it's just important to make sure we acknowledge that government to government relationship. And I think what's really important for everybody in this room to understand is that the government to government relationship is between the United States and the tribe. And there are some tribes who refuse to have conversations with state agencies because they have no relationship with the state of Washington as far as they're concerned. Their relationship is with the federal government. And so when you have a tribe that relies on their treaty like that, and rightfully so, you have to be very careful. And it's a lot harder to establish a trust relationship where you're actually able to even really engage with them. One tribe in particular in the state of Washington is They fight for their treaty at all times. And so we expend a lot of time just trying to get inroads with them and establish relationships. And, I have relatives in that tribe. And, we utilize those. And, that's why if you can find tribal members to come work for your agency, do it, because it helps. I have relations on every reservation in Washington State because I'm from here. And and those relationships come in handy. And our people are a community people. We're a group, and it really helps to have tribal people within your system. So current initiatives and tribal health priorities, I'm going to hand that off to Lucy.
So yeah, we've focused a lot of our we have a lot of work that we do in partnership with the tribes. As our Office of Tribal Affairs, we support our entire agency with our government to government partnership. We're as a office, we're that liaison between tribal governments and our leaders and our different programs. And the Healthcare Authority is quite large. There's several programs on the physical health, behavioral health side of things, women's health, gender affirming care. There's just all kinds of programs. Some I am still learning about 7 years later. But we have several initiatives, and I do want to mention, going back to that government to government relationship, the Washington State Centennial Accord, and the state law that we have in place. And there's certain requirements of each agency. So when I started with the healthcare, or excuse me, when I started with our Division of Behavioral Health and Recovery, those are the things that I was learning about, and learning about how we appropriately interact with tribes in that government to government manner. And so things that are really important to us, if a tribe asks us a question, a tribal elected official, tribal staff, being responsive is extremely important. And, sometimes we've had to explain, hey, we're getting contacted by a government. We have to respond ASAP. Those are important things to do. And so a lot of our work too is training and providing technical assistance to other teams. And again, coming as, from coming into the tribal communities in humility, and also in a listening mode, and really working through that government to government perspective and the things that how we operate. So I would say, a lot of the work that we do on our initiatives really reflect our collaboration, our consultations, and all of the communication that we do have with tribes, where we're listening to the needs, we're documenting the needs, and then we're not just throwing that away. So, a lot of times in state government, we write a strategic plan, and then we kind of shelf it. We're like, hey, we did a good job, we got the plan done. We kind of shelf it, and then in a couple years we're like, oh, we got to rewrite this again. So I think, and I go back to this because it's, I think, a way to build trust as well, is just making sure that we're listening, and we keep moving the requests forward. So in our framework, we are collaborating with tribes, we are listening to their requests, and then we are doing something about it. We don't just thank them for their feedback, we take action. And so I think that's a overall like framework for our team. I wouldn't say every agency is like that, but I know our team is really, we're action oriented. We try to do something about the barriers that are put up, and we partner with the tribes, tribal elected officials, tribal leaders, and our partners, like the American Indian Health Commission, the Northwest Portland Area Indian Health Board to all leverage our strengths and move things forward. And so this is a really good example. The Washington Indian Healthcare Improvement Act, that was really initiated, from requests from tribes, from tribes sharing concerns about, the government's response to healthcare concerns that tribes have put forward, and us kind of saying thank you for your feedback. Let's shelf it, and our having it like a program manager learn about needs or concerns or barriers, and then that they aren't decision makers, and so they can't really do anything about it, and then the next year the same barrier exists. So one of the key items of the Washington Indian Healthcare Improvement Act, which was written and put forward by the American Indian Health Commission in collaboration, written with tribes, and also vetted, went through the whole legislative session. Is it established the Governor's Indian Health Advisory Council, so it makes sure that the work, concerns, barriers, good work, continuing discussion, those discussions that can't be solved within a individual agency, that they are looked at that highest level in the state, at that government level, government to government level, where it's there's legislatures involved, the governor's office, and tribal leaders, and so that's one of the key items. And then it also creates a reinvestment account that makes sure that any cost savings that are saved from Indian healthcare providers delivering services to tribal members, that there any new cost savings, that those get reinvested back into tribal communities. And so there's a lot of details within those, but we definitely, those are two big initiatives, I think, overarching our work across the spectrum of healthcare. And it also involves other entities like public health, children, youth, and families, our commerce department that focuses on like capital expenditures, things like that. So, and next slide. Chrissy, do you want to talk about the traditional Indian medicine?
Sure. So as many of you probably know, traditional Indian medicine, 1115 waivers were approved for 4 states: Arizona, California, Mexico, and Oregon. And basically, it's an opportunity for tribes to bring traditional native practices for healing into the healthcare system. The Seattle Indian Health Board actually kind of pioneered this work and established a regimen of treatments that they provide, and it's very unique. And what I like about all of these waivers is that I've looked at, they allow each individual tribe to determine what their practices look like. So when these waivers were written up, CMS did them very open-ended. I'd describe it as, where each tribe could identify what their traditional practice was. So it wasn't, okay, well, we do sweats and we do drum group, and we do, and this is what you guys can count for traditional Indian medicine. That's not how they did it at all. What they said was each tribe will develop a program of services that they're going to provide for their people. And it just allows every tribe to provide what's important to them, rather than, stamping us, all us Indians are the same, right? No, we're not. We're actually very diverse and very different, and our cultures are absolutely opposite in many cases. So Washington State is in the process of working on their TIMS waiver. Our tribes are not very happy with us because we weren't one of the original 4 states that got approved. So we're working diligently on that. But this is where, culturally attuned care really can have significant improved health outcomes. The Seattle Indian Health Board has been documenting their program for a few years now, and they have seen drastic improved health outcomes in the patients who receive traditional Indian medicine services, and it really is a meshing of spiritual, cultural practices with modern medicine. And I think it's going to be a game changer for Native health systems. So keep an eye on it. And, if you have a large population of tribal people, support it, because it's good medicine.
Thanks, Chrissy. Yeah, I think that's key to highlight is I think sometimes we feel like we're the first in the nation to do some things, but this one we're a little bit behind on. And what I love about the work that we do too is like I get to see so much, really strong tribal advocacy. I'm very inspired by it. And the tribes really pushing these initiatives and requiring us to get this done. And so that's kind of what's going on right now. And so we're gearing up. We're excited to move that work forward. Like for our part, there's multiple, roles, I think, between all of our partners. But so we're excited to do our piece of it next. So I want to talk a little bit about our overall statewide tribal state opioid response work. Opioid response, really what I've seen, like, significant efforts to address the opioid crisis. I think back in 2017, it was, like, well, we can't call it an epidemic yet. It's a crisis, or it's a concern. And so there were some grants that came out, and we were able to work with the tribes on through an opioid response work group. It was pretty informal. And we started that about 2017, 2018, in partnership with the American Indian Health Commission, and just bringing tribal partners together to talk about opioid response concerns and resources. And so that's been in place for quite a while. I would say in the last couple, maybe 3 years, as there's, especially coming out of COVID or during COVID, when there was just such a significant increase and just devastation, I would say, in many tribal communities where there was significant loss due to opioid or fentanyl use. You know, the tribes, again, taking lead in the state, in the nation, just saying, hey, we need every single partner that exists within our state and federal government, and really moved us to, we did have a lot of initiatives in partnership with tribes. One of the projects that we also worked on in partnership with tribes was a tribal specific opioid campaign around 2017, 2018. So we had a initial campaign that launched, and that still exists and has evolved. But a few years ago, tribes really wanted to make sure all the partners were at the table to address the significant disparities, where Native individuals, tribal members there was a very significant loss of life within tribal communities, and all that comes with that. So again, we partnered and got to work. One of the initiatives was to establish a tribal state opioid task force, and again, led by tribes, the American Indian Health Commission. We have some legislatures that really moved this work forward and got the funding, put it into legislation. And so our work group that was, kind of a mini work group, informal, is now, one of the subcommittees in this larger task force. And we also had an initiative where there were 5 tribes that went and visited some prevention models. And so we have an investment in the Washington State Tribal Prevention System where there's 5 tribes that are working on a pilot, kind of all doing similar programming to see over time if this certain model is going to have good outcomes within the tribal communities, and that might inform, our priorities or funding in the future. So that's one of the big initiatives that came out of that. We also had a state and a tribal state and a national opioid and fentanyl summit. I think we were the first in the nation that was hosted by the Tulalip tribes. Lummi Nation hosted the first tribal state opioid response. And again, this was really advocacy and requests from the tribes asking us to partner, funding secured, by the legislature and the governor's office. And then, us, you know, how, figuring out the funding and partnering and implementation of these things. So the other thing that I think is really awesome in our state, and I mentioned this earlier, we have at least 10 tribal opioid treatment programs, and we have at least 3 that are in the works. And so I think that's quite a lot. There's been some legislation related to opioid response, tribal warrants legislation, and again, advocacy of the tribes. This is not just healthcare authority. This is the tribe's efforts, and we're a piece of that, of all this work. So we also had our opioid abatement from lawsuits, through consultation, through ask from the tribes. What we were able to negotiate with the tribes was having a 20% set aside of that total opioid abatement amount. And since then, the legislature established an account that was the minimum of 20% set aside from all of the lawsuit funds. So, these are great resources because the tribes are really in our state, they're leading best practices, leading opioid response efforts across the state. And so it's really important that, we're doing, as a state agency, doing our part to support funding or any barrier removal around them providing these really awesome services to their tribal members or community members. And they're oftentimes, a lot of the tribal opioid programs are serving non-tribal members in the surrounding community. So it's, there's those great outcomes for the entire community as well. So
I just saw a statistic that 75% of the clients in these OTP programs in Washington State are not tribal people. And so the tribes are providing an essential service to the communities. The tribes are disproportionately impacted by opioid overdose deaths, of any kind. Those, I've often heard it said at our tribal meetings, those drugs didn't come from the reservation. Those came in, and the tribes are doing their best to address a crisis that exists within our communities, and not just Indian communities, all of our communities. It really is becoming a huge epidemic. So we're going to hurry up, and just because we are running out of time, and we wanted to give an opportunity for people to ask some questions. Lucy, did you want to just go over this real quick?
Yeah, I'll just touch on this really quick. So we have a lot of initiatives for crisis response, and this actually was a big part of my work when I first started. I was asked, work with tribal partners, get some feedback on, how to work together to stand up more crisis services. And it's evolved for over the years. And so there's several initiatives, tribal state partner initiatives around the whole 988, the whole crisis system, looking at, someone to call center resources, someone to come, mobile crisis, involuntary treatment, things like that, and a safe place to be, looking at facilities and really the tribes taking on crisis work. And so just want to mention there's a lot of work on that. And if anybody has questions about that, please let us know. So I'll stop there.
Mm.
Yeah, I think just really quick, I talked about this earlier. There's a healthcare parity versus in coverage, managed care versus not managed care. That's something that's been there's a lack of parity in our state, so we continue to partner with tribes to try to figure out how to address that kind of difference in resources between the two programs. So I think I'll just say that for now, and
And
then
lastly,
go ahead.
Lastly, we have the Medicaid Transformation 2.0 Native Hub that we're developing, and um, we're looking to work in coordination with the tribes to build a tribal consortium, acting as a third-party provider, administering the healthcare initiatives within Washington State, focusing on coordinated care, crisis response, reentry services, and whatever needs the tribes have. It's going to be an interesting project, and so we're going to be sharing a lot of information on that as we get it rolling. So with that. That's our contact list. Are there any questions? I know we don't have a whole lot of time.
Thank you. Thank you. A very heartfelt thank you to our amazing presenters today, Lucy and Christine. You have provided such a powerful overview of tribal history and contextual factors like generational trauma, that emphasis on trauma-informed care. Your commitment and guidance that you provided for culturally attuned and respectful services is so needed. I do see some questions coming into the chat. Someone had asked, what are some accurate resources for the history of tribal communities, American Indians? Any other resources that you might give for learning more about tribal communities?
We developed a links page for that, and if it's all right with you, Amy, I can send that links page to you, and you can send it to the people who are in this group. I don't have it on the top of my head, but there's several links that we've provided.
And
Thank
Christy,
you.
I want to add too, I think one of the things I found is there's many tribes that have web pages where they're documenting their history, or I've even seen some tribes where they're presenting to the community um their cultural program, or there's I can't think of the name, like their tribal historical programs offer some information. So I would definitely look on tribal specific websites and see if they have resources for the communities, because I've seen a lot of tribes share resources, share their history in either video formats or on their website, or certain maybe books that are published or supported by the tribe. So definitely go to just the different websites, which we have a link. We can provide a link to that.
Perfect. Thank you so much. In terms of, I have a question on trauma-informed approaches. What are some trauma-informed approaches that might be particularly useful or effective and meaningful in working with tribal communities?
I don't I'm the worst at remembering names of anything, so I'll add that to our links page. There have been several trauma informed programs that I've gone through, and some are great and some are not so great. So I'll pull those up and add that to our list that we send out. My
Perfect. Thank
opinion, they're just my opinion though. So.
you. Looking through the chat, I missed anything. Oh, there was a question How were individuals from tribal communities able to get a seat with the state and federal government in order to participate in tribal laws and regulations?
Mm,
So tribes themselves have the authority to establish their own laws within their reservation boundaries. When we're talking about like healthcare policy or state policy, you really have to advocate. In Washington State, we have the Governor's Office of Indian Affairs, I think it's called GOYA, and
mhm,
and so that's basically the governor's liaison to all the tribal people in Washington State, and that's a direct link and contact for our tribes to get involved. And then every agency in the state of Washington is required to have a tribal liaison group within the agency. And so, like for HCA, that's the Office of Tribal Affairs, and we are their direct contact. Specifically in our organization, we have four regional tribal liaisons that have name recognition within the tribes they are assigned, and they live in that general area, um, and provide that support. And so, what we say is in the Office of Tribal Affairs, there's no wrong door. You can ask us any question. We don't care if it's about, land dispute or whether it's about water pollution. We will find you, whether it has anything to do with healthcare, we will find who you need to talk
Yeah,
to at any other agency. And so the biggest thing is for tribes to find out, where are these liaisons, whether it's in the governor's office or within the agencies. Every state is different, so it's different in every state.
oh, someone is asking as a follow-up. Some agencies don't have access to their own liaisons. Any other suggestions for agencies on building sustained and respectful relationships within tribal communities rather than just having like one-off collaborations?
You know, it, it's very important that if you are going to engage tribes directly, that you have some cultural competence before you try to engage in that manner. And so, you certainly could build relationships. You might need to find a bridge. Maybe a tribal member. Get some information, but you'd have to be very cautious because you need to have somebody who has some basic understanding of how to interact with tribes. And like I said, I call the secretary, I call the admin assistants when I need help. And I just tell them who I am. I'm very humble about it. And, I often can talk about a relative down there that I have, right? So that gives me an in, it gives me some trust, but you can establish meaningful, trustful relationships with individuals within tribal entities if you have the authority to directly contact tribes. But again, just be cautious, be careful.
Yeah, I think I'll just add to that just to say, I think we're lucky in Washington State. We have a lot of policy that we can point to, and I'm not sure, where folks are at, but I think, you know, we have to be careful about advocacy, but, voicing sometimes it's can be difficult to be that voice, and tribes, like, what about tribes? But that's sometimes we joke about it, sometimes we are, we are, it's hard, it hurts, but it's consistency and saying, okay,
Yeah,
what about tribes? Did you think about tribes? How are tribes incorporated? It's just, to me, asking the question over and over and over again, even though you might be the person asking the question over and over again, and being comfortable with that, because and I wouldn't say that's advocacy, it's inquiry, and sometimes that does lead to change and meaningful conversation. So I would recommend something like that too, if you don't have access to your liaison, but if you can, try to get access and share the importance. I think those are some strategies you might want to consider.
yeah, those are great recommendations. Again, I want to thank our presenters today for sharing their wisdom, their knowledge, their expertise, and their leadership, and being mindful of providing really culturally attuned, respectful services to tribal community members. Please note there is a link in the chat to fill out a survey for today's session. You will be receiving the recording as well as the PowerPoint slides. Is it okay, Christine and Lucy, if we give people your email addresses in case they do have any follow-ups from today's session?
Of course.
Thank you. Thank
We're
you
always
so
here to
much.
help.
Perfect. Thank you, folks. Thank you for attending. And again, thanks to our presenters. Hopefully, I will see you in future sessions. Be well.
Thank you for your
Thank
time.
you all. Thank you.